Hi, my name is Mollie Bowman, and I'm a nurse practitioner student at Auburn University. Today I'm presenting my pharmacology project, and it is on sulfonamides. I thought this was pretty cute. So, like I said, my drug class was sulfonamides or sulfa drugs. These are some of the common drugs that are sulfonamides. So sulfonamides or sulfa drugs are antibiotics. They treat bacterial infections. They inhibit both gram-positive and gram-negative bacteria. It's important to know that sulfa drugs are bacteriostatic and not bactericidal. So they inhibit the growth of bacteria. They do not kill bacteria. The therapeutic effects are to treat bacterial infections. They also treat ulcerative colitis and rheumatoid arthritis because they have anti-inflammatory properties, and they're topically used for patients with severe burns. So the pharmacodynamics, there are certain microbes that require PABA to synthesize folic acid, and what sulfonamides do is that they inhibit PABA in the folic acid metabolism cycle, and they inhibit both gram-negative and gram-positive bacteria. So sulfa drugs are absorbed from the GI tract and distributed widely in tissues including the CSF, pleural synovial fluid, and the eyes. They also cross over into the placenta and enter breast milk. So the FDA categorizes sulfa drugs as a pregnancy category C. So the metabolism, it occurs in the liver, and excretion, they are renally excreted by glomerular filtration. Some precautions. So sulfonamides are used cautiously in patients with blood dyscrasias, renal impairment, and folate deficiencies. Sulfa drugs may cause blood problems, and they may cause your skin to be super sensitive to sunlight and UV rays, which is called photosensitivity. They are contraindicated in patients with any allergies to sulfonamides, sulfonylureas, or thiazide diuretics because of cross-sensitivity. They are teratogenic, so are contraindicated in pregnant women and with patients with kidney stones or renal disease. Some adverse drug reactions are the same for all, other antibiotics. We have the nausea, vomiting, lethargy, headaches, but there are some serious skin disorders that can occur with sulfas. So that's Stevens-Johnson syndrome and toxic epidermal necrolysis. And some rare side effects are liver damage and formation of urine crystals. So you want to keep these patients well hydrated. These are some drug interactions. They're most common use for bacterial infections, and that's not only UTIs, but pelvic inflammatory disease, acne, otitis media, pneumonia, meningitis, and traveler's diarrhea. Like I said, the rational drug selections is for UTIs, and that's because they work and they are a very low-cost medication. We want to monitor these patients who are on sulfa drugs for therapeutic response. If they have a UTI, we want to culture their urine at their follow-up appointment to make sure that the drug is working, and we want to monitor for other allergic reactions. If they are on long-term treatment, we want to monitor the CBC, hepatic and renal function, and urinalysis to check for that urine crystallized formation. To educate these patients, we want to make sure that they complete the full course of antibiotics. That's very important, and to take these drugs on a regular schedule. We don't want them to miss a dose and to not double doses. Also, make sure that they drink lots of fluid to prevent crystallized urine and to monitor the skin for any new rashes or blisters. Also, because of the photosensitivity, we want our patients to stay out of direct sunlight and to wear protective clothing. And that includes hats and sunglasses, long sleeve shirts, and to drink plenty of water again. So my main takeaways. First one is photosensitivity. So photosensitivity is a sun sensitivity, and this can cause a moderate to severe skin reaction. So it could just be mild redness, or it could be swelling and blistering. And this is from the UV rays of the sun. Most commonly occurs on the forehead, lips, hands, arms. So to prevent this, we want to apply sunscreen before going outside, at least 30 SPF. But right here I have a 100 SPF, so this is the best for those patients. Also use sunblock on your lips. Don't forget your cool shades, and limit time outdoors when the sun is at its peak, and that's usually between 10 a.m. and 3 p.m. And avoid tanning beds. They're no good. Thought this was pretty cute. Okay, my second main takeaway, Stevens-Johnson syndrome. So we went over this a little bit. It's a serious disorder of the skin and mucous membranes. These patients require hospitalization. It's a medical emergency. The skin becomes really painful and red, and then it can blister and slough off. And if these patients say that they had this, definitely don't give them a sulfa drug. And I will show you a picture. This poor girl had Stevens-Johnson syndrome. Last one is urinary tract infections. So this is a bacterial infection anywhere in the urinary tract. The burning, urgency, frequency, bloody, cloudy urine that's super dark, not good. We give them a sulfa drug. It's because they're inexpensive, and most commonly is Bactrim. When you get a bladder infection, you're in trouble. And then I thought this was really good to help remember sulfa and what these drugs do. So sunlight sensitivity, undesirable effects, which is your rash and renal toxicity. And we want to look for urine output, sore throats, and bleeding. Fluids, we want to encourage our patients to drink lots of fluids, and watch out for anorexia and anemia. And those are my references, and that's it. Thank you.